they have to say.
For today, Mr. Michael Schumer, please go ahead, sir.
Thank you for joining us for the COVID-19 media call for November 4th. We'll start today's call with comments from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Chris Ayersman. We'll then open up for questions on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everybody. The United States added another 92,000 cases in the last day and another 1,069 deaths from COVID-19. We're now at over 9.3 million cases and over 232,000 deaths in the U.S. Globally, there was an increase of over 500,000 cases and just under 8,000 deaths yesterday, bringing the worldwide total to over 47.5 million cases and over 1.2 million deaths. In Minnesota, we announced another 3,844 cases announced today, bringing our new total to 160,923 cases of COVID-19 in Minnesota. This is the first day that we can recall having a new COVID case in every single county in Minnesota on the same day. There are currently 887 Minnesotans hospitalized with COVID-19. 219 of them are in intensive care. And sadly, we lost another 31 Minnesotans yesterday for a new total of 2,505 deaths in our state. This was across 20 counties, 23 deaths from Greater Minnesota, and 8 in the Twin Cities metropolitan area. Two persons, one person in their 30s, another in their 50s, both with underlying health conditions, and the majority of folks in their 80s and 90s. The 3,844 confirmed cases that I mentioned was on a very high testing volume, 32,797 lab tests. This is another new high for case counts and a particularly high volume of tests for this point in the week. This is our fourth day now of more than 3,000 new cases in a day, and I'm afraid we need to brace ourselves for hitting 4,000 cases at some point in the very near future. The weekly change in cases continues to accelerate. We now have 15.4% growth in cases since last week, which is an increase from a 10.2% weekly change the week prior. That's more than a 5% point increase in case growth in just 1 week. And the weekly change in testing does continue to go up as well. We had 7.8% more total tests last week than the week prior. But despite that, case growth is almost double the growth in testing. And you see that in the average positivity rate. Our 7-day average testing positivity rate is now 9.2%, up from 6.6% the week prior. So that too is a pretty startling jump in test positivity rates. What's happening in Minnesota right now certainly is disheartening and alarming. And we've been talking about kind of using the wildfire analogy to talk about COVID. Many public health leaders have used that image that the wildfire will seek out and find any wood that's available to burn. And we've been surrounded by wildfires in our neighboring states for some weeks now. And while we've been trying to keep the flames from expanding and overtaking Minnesota, right now it feels like we're losing ground. We're seeing record numbers of new cases, set a new record every few days, and it's because we're falling behind the rapid spread of this virus. And as we said, this is truly a statewide outbreak. The hottest spots of the outbreak right now are in Greater Minnesota. Case numbers are increasing particularly rapidly in the western half of the state and in central Minnesota. We've also talked a lot about who is what and who is driving a lot of the spread of this virus. That we know that a significant number of the new cases are among younger adults, younger working adults, people from between the ages of 18 to 35 are circulating in the community. Many of these people have no or very mild symptoms and have no way of knowing that they're positive or who they are interacting with that may be positive. If they have no symptoms at all, or perhaps some are just understandably perhaps dismissing a headache, extreme tiredness or achiness and thinking it's just stress or the change in seasons or any number of other things, but really kind of discounting the fact that it could be a symptom of a COVID exposure. And we can see in the data how the spread is happening too. We talked about this. It's happening not only in certain settings, certain entertainment settings, bars and restaurants, for example, other venues where people gather, but also with small groups of friends and social gatherings. It's happening in our backyards. It's happening in places where people gather in groups and start to feel comfortable and relaxed, and like the social mitigation measures are not needed in that setting. But the fact is that gathering in a group of people is risky right now. You can certainly help to mitigate that risk, lower it by keeping the number in the group lower, by staying outside, by keeping 6 feet apart, and by wearing a mask. It's also helpful, I think, to be open and to talk with friends and family, and to be honest about whether you have some mild symptoms that you're concerned about, or that you recently spent time with a group of friends. Sharing information helps everybody make better informed decisions about what they personally need to do. We have said this over and over, but it just continues to be so true. There is so much we can do as Minnesotans to help affect what happens from this point. We can either help to slow the spread of this virus, or we can help to accelerate it, depending upon whether we do or don't choose to follow the guidelines that we know are effective in reducing transmission. And that is, again, keeping social distance, avoiding large gatherings, wearing masks, seeking out testing, and staying home if you're sick, and frequently washing your hands. And we've said, I think also, and it's important to just keep reiterating, with this much virus transmitting in our communities, we know the risk cannot be eliminated down to zero. But everything we do, this layers of risk protection, can help and minimize the risk. And we can balance out the risks that we're willing to take in our lives. And one thing we might suggest is that you think about some of the things that are the most important to you, and consider if there are other things you'd normally like to do that you're willing to forego in order to increase your chances of being able to do other things, like, for instance, being able to visit your aging family members. Nobody can make those decisions for you, obviously. Everybody needs to find the right balance of activities to be realistic about their risk and to help manage that risk. The level of virus circulating in our communities is at an all-time high. This increases the chance that you'll be exposed, even if the people you're with have no symptoms. If you have medical conditions, and over half of us do, or are an older Minnesotan, you need to be extra careful. Everybody needs to consider how to limit their interactions at this point in time outside of our immediate households. But I'd like to give a little update on our testing strategy. We continue to have a multi-pronged approach to managing this virus. And we've talked about those basic prevention measures. Every part of that strategy is important. And as we've said many times, testing is certainly one important part of that overall strategy. It helps identify who is sick, and then so those folks can take appropriate action, can get treatment, and can isolate and quarantine as necessary to help break the chains of transmission. We've done such important work to expand testing, access to testing for Minnesotans, to try to remove barriers to make more options available to more people. We've done it in the partnerships that we've discussed many a time with our state's health systems, with the University of Minnesota and Mayo. We've done it through opening a saliva testing site, holding community testing events in people's neighborhoods. We've emphasized that testing is open to anyone, even those who are asymptomatic. We've tried to make it easier to get testing without health insurance being a barrier. And now, just recently, thousands of people in 24 of our counties and one of our sovereign tribal nations are participating in a pilot test of ordering saliva tests through a mail order program. The pilot's going well. We're learning some things and we're working on some improvements before we launch the rollout of that mail order program very soon, hopefully in the next week or so. We do want to again, thank all of our partners who've built this really pretty remarkable testing infrastructure in our state and the capacity that we've collectively been able to add through the health systems, again, Mayo, the university, as well as our new partners, Vault and IDX. And due to all of this testing, people are receiving test results faster than ever, and that's important. While we certainly know that some people continue to experience barriers or results that are not as fast as we wish that they were, and as Chris has said many a time, if that's your situation, that's not good, and you're not terribly impressed to know, even though it's true that the vast majority of these tens of thousands of test results each day are coming within 48 to 72 hours after getting tested. With that in mind, I'd like to spend a little bit of time, again, reiterating the many ways in which Minnesotans can seek out testing and are doing so. In the past 6 weeks, we've opened 7 additional saliva testing sites across the state. The first one was opened in Duluth on September 23rd. Since then, we've added 4 more sites in Greater Minnesota, in Winona, Moorhead, Mankato, and St. Cloud. And we've opened 2 testing sites in the metro area so far, Brooklyn Park and St. Paul. We're working to add several more locations in the metro area and expect to have details on that in the next few days. Most of these sites have opened just in the last 2 or 3 weeks, but already in total, we've tested more than 50,000 people at these saliva testing sites. And we've gotten already nearly 7,000 positive test results from those sites. That's a total positivity rate at the saliva sites alone of over 12%. So that is just further confirmation of the fact that there's a lot of virus out there that we need to be further expanding testing to keep pace and catch up with the spread of the virus itself. I just want to highlight that this isn't just a case of some pent-up demand that you can solve one time. We've seen testing numbers increase week over week over week at every one of these sites. For example, last week there were more than 3,400 tests in Duluth, which was up over 1,200 from the week before. And I could share the data from each of those sites. And our St. Paul site is the most recent to open, and in just 5 days, nearly 5,000 people have been tested. Our biggest turnout has been in Brooklyn Park, where we've tested more than 18,000 people, nearly 1,700 a day in the last few days there. Testing and, sadly, test positivity rates at these sites is continuing to grow and is accelerating. It's really pretty sobering to witness the clear need that is out there for our community to have access to testing. And as I mentioned, we're making at-home testing possible as well with the saliva tests. Since the beginning of the pilot that I referenced, nearly 7,000 testing kits have been ordered. And 811 of those kits have been used, have been returned, and results transmitted back to the people. We've been working around the clock to implement improvements based on the pilot, which includes making the online ordering process smoother. Next week, we do anticipate being able to roll that program out statewide. We're in week 7 of our statewide push through pop-up community testing events with support from the National Guard. That includes events in more than 30 communities, with more planned for next week in Burnsville, Morris, Owatonna, and Stillwater. We've talked a lot about Dr. Birx's last visit to Minnesota. She was here just a couple of weeks ago, and she had plenty to say about her perspective nationwide on the alarming increases in cases all over the country, and particularly in the Midwest and in Minnesota, and our need for more comprehensive mitigation strategies. But she was very complimentary about our testing infrastructure in particular. And it continues to be just a critical tool going forward. We've provided access to thousands of people who otherwise would not have been tested. And we know how important it is to keep on making testing more and more available. We know that asymptomatic people are coming to that testing events and sites, and they're doing it because we've made it easy for them to get these tests. And hopefully the message is getting through that asymptomatic spread from people who have no idea that they have the virus is a part of what is fueling this expansion of cases around our state. 6 months ago, we know the testing, seeking out testing, getting tested was just not an easy task. There were limited testing supplies. There were differences in approach and differences in criteria, often taking multiple attempts to find a place to get tested, seeking out insurance information, or simply being told that you didn't qualify for testing. But that's really changed a lot. And while it's certainly true that certain sites have certain kinds of tests and certain types of criteria, we can say with confidence that we are building an infrastructure to make it possible for people to get tested when and where they need to. And we're grateful that the other states are beginning to look to us for lessons learned and as models about how to make it easier to get tested. Again, we just simply want to encourage anyone who thinks they need a test to seek one out. And with that, I will turn it over to Chris.
Thank you, Commissioner. I'd like to talk about deer hunting and contact tracing. And just a note, for those of you that know me, know I'm not offering any tips about how to do a better job of hunting. I couldn't hit the broadside of a barn if I tried, but I'd like to talk a little bit about the upcoming deer hunting season and how to be safe for COVID. We know that this weekend is the start of our deer hunting in Minnesota, and we want to thank the Department of Natural Resources for the work that it's done to remind hunters to be safe during a hunting season that overlaps with a raging pandemic. Our reminder to you as hunters is that the same considerations you need to keep in mind in other settings are ones to keep in mind while you're hunting. So remember that indoor shacks or shelters have the same concerns we would have for any other indoor space. And although you will be spending time outdoors, which is safer, it's not entirely risk-free. So keep in mind, if you're hunting with people from outside your immediate household, please mask up while indoors and keep a distance of 6 feet at all times inside and out. And you may want to consider keeping your mask on when you're outside as well. And if you're feeling under the weather, please stay home. And then I also wanted to comment on the large number of cases that we continue to see. And the commissioner went into a lot of detail about those exploding numbers. As our daily case counts increase, our contact tracers are doing their best to keep up and get in touch with COVID positive people within 24 hours. And we're adding new staff to bolster their numbers. But we want you to know that regardless of when you get the call from us, it's very important that if you get a positive COVID test result, please, first of all, isolate yourself. And if you've gone in for testing because you're symptomatic, we would ask that you're isolating even while you're waiting for your test result. But once you get the call from the provider to say that you're positive, we'd ask that you let people that you've been in close contact with know that you are positive. And that is individuals who you would have been with in the 48 hours before your symptoms developed, or if you're someone who went in for testing and tested positive and didn't have any symptoms, it would be in 48 hours before you had your test taken. Let those people know that you've tested positive and that they should be quarantining themselves. And then you want to stay isolated from the time that your symptoms start until at least 10 days have passed and all your symptoms are gone. And just as a reminder, when we talk about close contact, we mean being within 6 feet of someone for 15 or more minutes. And that's cumulative. So that doesn't mean if you were with someone for 2 minutes and then 5 minutes, if all those times that you interacted with someone add up to more than 15 minutes, we would consider that to be a close contact. So remember, if you're symptomatic and you're getting tested, stay home until you get those test results. If they're positive, you need to stay home for at least 10 days and until your symptoms resolve. Once you know you're positive, please reach out and contact those people that you've been in close contact with. and tell them that they need to quarantine. And the people that you want to think about are the people that you were interacting with 48 hours before your symptoms started or 48 hours before you were tested if you don't have any symptoms. And with that, I'll turn it back to Mike.
Thanks, Chris. Operator, we're ready to take questions.
Thank you. And as a reminder, to ask a question, you will need to press star 1 on your telephone. Again, that's star 1 on your telephone. We'll pause for a moment to compile the Q&A roster. We have your first question coming from the line of Sharon Yu from Care 11. Your line is open. Sharon Yu, your line is open. We have a question from Jeremy Olson from Star Tribune. Your line is open.
Hi, I wanted to ask about the current level of hospitalizations. There's some reports of ICU beds being scarce or just out in the Twin Cities and some other episodic shortages of ICU beds across the state. What is your assessment of the current hospital capacity and whether any new strategies need to happen?
Commissioner?
Thank you, Chris. You're right. I was on mute. Thanks for the question. As case numbers skyrocket, as we've been saying, we know that hospitalizations lag a bit behind case growth, and sadly, mortality lags behind hospitalization. So as these numbers continue to go up, we're concerned about capacity in a lot of different contexts. We absolutely acknowledge that these numbers strain many of our critical systems in our society. And we've talked a lot about the fact that we're working very closely and that there's a really unprecedented degree of partnership going on across the health systems and with their regional health coalitions, and a critical care coordination center that we have at the State Emergency Operations Center to actively assist hospitals in what we refer to as load leveling, to be able to know where those pinch points are and to help move capacity around the system and move patients to where there is capacity to find beds available in real time. That's been a very successful approach to date. We've talked about the fact that hospitals have been pretty full throughout the summer in Minnesota, not with COVID patients, but full in general. And this coordination activity has been pretty successful to date. And we're increasing the frequency of these meetings and working to get even more real-time data in the hands of the people doing those bed placements. We know that hospitals are working hard to manage their capacity, and they're using a number of tools at the level of the individual hospital or health system. They're doing a lot of things to redeploy staff internally, to move patients around within their facility, within their systems or their region, to open up more space in tertiary care facilities, and beginning to, when they need to, delay some less time-sensitive procedures. So all of that is happening, and I think that's indicative of the importance of keeping a close eye on this. And I don't mean to suggest that there's no cause for concern, because at these numbers, we know that the capacity limits are a real thing. But so far the systems that are in place have been working in a pretty commendable way.
And Jeremy, I can give you the data that we have. The ICU capacity in the metro is at 98% in use, and medical surgical bed capacity in the metro is at 97% in use. Our statewide ICU capacity is at 92% in use, and our med surg bed capacity is at 88% in use. And because of the large number of cases that we're seeing, we continue to urge Minnesotans to take the public health guidelines really seriously, because that will help them as well as our healthcare system.
One of the issues isn't just the physical beds, but whether they're staffed. There's people to staff them. Do you have any concerns right now about the staffing, and also that last week's CDC report had noted a number of nurses and other healthcare providers coming back before their quarantines were technically over to return to work. Is that something you encourage, or do you see that being part of the strategy if need be in the future?
I think you're absolutely right. It's not just the beds, it's people staffing the beds. And when I alluded to getting even more real-time data in the hands of the folks who need to help kind of manage this capacity, it was specifically staffing that I was referring to there. I will let Chris speak to the CBC study, which, as you know, was work done by our team here in Minnesota. So, Chris, would you like to comment on that?
Sure. Jeremy, our guidance is that we want healthcare workers who are infected to isolate for the full duration, and those who've been exposed to quarantine for the full duration. There are options that can be considered in a dire staffing situation, which would include that someone who needs to be out on quarantine could work in a non-patient care setting with full PPE. There's some things like that we can work with healthcare providers on, but that is really in the most dire situation. And so, our goal is to work to make sure that individuals who are obviously positive are isolated for the full amount of time. And even those people who've been exposed, we want to make sure that they can quarantine. But there are some options that we can, discuss if there's a challenging situation.
Thank you.
Your next question is from the line of Erin Hassan-Sadi from WCCO. Your line is open.
Hi, so that was a similar line of questioning to what I wanted to raise, but just building off of the ICU bed capacity, we're wavering so close to 100%. Can you talk about what that dire situation looks like in Minnesota? I mean, what happens when we hit 100%? And I know you talked about some of the strategies, but correct me if I'm wrong, this seems to be the closest we've been wavering to 100, and with you saying we should expect to see even more cases in the coming weeks. What does this realistically look like if we go into that red zone?
Well, I do think this is Commissioner Malcolm again, as I alluded to, some of the things that the systems are already doing internally are, a lot of movement around their facilities and around their systems, moving patients regionally, and having to begin to defer less time critical services. That's probably the largest level, and something that we know might be necessary. But we also know that when other types of care have to be deferred or postponed, that has its own health consequences. So that's certainly why we're hoping to do everything we can to try to get upstream and try to stem the increase in these cases, so that we can keep the hospitals operating. They historically run really pretty tight, if you will, or pretty lean in terms of not carrying a lot of excess capacity at any one time. But it's just really important that they be able to serve patients with all kinds of needs and not just COVID. So we're just working very hard and need Minnesotans' help to keep COVID from crowding out other medical conditions as well.
Okay, and then just to follow up, you mentioned we should expect to see, upwards of 4,000 positive cases in the coming days or weeks. Just talk about how long you think that sort of stretch will last. Could it get significantly worse? I mean, are we in a more severe kind of hunkering down stage, or is that where we're headed?
Well, that's certainly the concern. It's like where is the trajectory likely to go from here? And we know that if there isn't kind of an increase in those preventive behaviors, if there aren't reductions in some of the kinds of contacts that are leading to transmission, then we expect the numbers to keep going up, as we have seen, and we are still not increasing at as fast a rate as many of our neighbors. So that's, I guess, the good news. But anything we can do to keep, to kind of keep the lid on the case growth and start to reverse it and see fewer numbers of cases, it is what the goal is. We know we can't keep all COVID out of Minnesota for sure. We know we're affected by what's happening, all around the country. But we absolutely think that it's still within our power to affect this trajectory. And again, I'll just emphasize part of the importance of getting more testing out there and trying to get the message out to people that there is a great deal of transmission happening among people who have no idea they have this virus, and why it's so important that we all take those mitigation strategies seriously, of avoiding crowds, keeping distance, wearing masks, but why we also really need people to get tested when it is recommended that they do so.
Thank you.
Operator, we have time for one more question.
Thank you. We have your next question from Catherine Richard from Minnesota Public. Your line is open.
Hi, some follow-up questions on the ICU stuff as well. Anecdotally, over the last few days, I've been hearing from doctors and nurses who are telling me that it's taking longer for them to find beds when they need them, if they need to make those transfers. And they're also seeing patients have to be transferred further than usual. What does that say to you, Commissioner Malcolm, in terms of where we are? Does that raise any red flags for you?
Well, I think it's just further indication of the kind of the real world consequence of the numbers that we're seeing in general. That it's just putting stress on the systems that I think all of us are motivated and should be motivated to try to help stem the tide, if you will, by taking these measures that are in our control more seriously. And yes, it's certainly desirable to keep patients as close to home as possible, but getting them the right level of care that they need to manage the severity of their condition is certainly a primary purpose as well. And I mentioned before, there is actually quite a lot of coordination happening within the regions of our state, with health systems and hospitals cooperating with each other to make the best use of the tertiary care capacity in that region. So I just commend the systems for all the collaborating and information sharing they're doing with each other and with us. And we're certainly going to need every ounce of that collaboration and that real-time data sharing and problem solving to manage our way through this.
Sure, and we've talked a lot about that before, but does the state know how many staff statewide are out right now because they either have COVID or have been exposed to COVID? And does the state have any way to, coordinate, nurses and doctors in the same way that they have been able to coordinate beds and transfers?
Well, I think the same basic system of coordinating capacity applies to staffing as well, and has been used by the systems to assist in cases of staffing shortage, not just bed shortage. So I think that those basic systems do work. In terms of how much data do we have on numbers of staff, I think Chris has spoken before about the fact that we have a special team of epidemiologists that work with exposed healthcare workers. So when cases come through and we know they're healthcare workers, we've got a good line of sight to their status and are working with them. But in terms of how many workers might be out of work who haven't been tested, that we don't know. But we're actually talking with the health systems about how best can we compile some of the kind of real-time on-the-ground information they have on a day-to-day basis to get a bit more of a statewide picture.
Okay, thank you.
That's all the time we have today. We do invite any reporters with additional questions to reach out to our communications office this afternoon. Have a good day, and we will be back with you again on Friday.
You were just watching Health Officials.